Hello and welcome to Health Talk. I'm Rick Leventhal, sitting in for Dr. Manny. Personalized medicine used to be a thing of the future, but the future is here. Doctors are now using a new technique to prescribe more effective medicines for chronic pain. Joining me now is Dr. Anita Gupta. She's an anesthesiologist and pain specialist at Drexel University College of Medicine. Thanks so much for coming.
My pleasure.
So how does personalized genetic testing work in your practice?
So as you know, we're all made very differently genetically. And these differences that we have genetically actually influence how we respond to medications. So what I have is actually a test that may predict a patient's response to these medications. For example, one patient I give one medication, they may actually have a wonderful benefit, and then the same medication in a different patient, they may actually have a severe adverse event.
So you have a test that can predict how a patient will respond to a particular drug?
Yes, it's actually called pharmacogenetic testing, and it's sometimes coined as personalized medicine, but this is a very specific test that looks at how drugs are metabolized to your individual body.
So what is the test? How does it work?
So essentially, an individual, if they need to have the test done and if they're an appropriate candidate for it, they're given a sample of their saliva. That saliva is sampled by a laboratory, and then a result is sent back to the physician who ordered the test.
And then what happens?
On an examination, usually when I see my patients, I'll review the results with them. I'll go over what kind of metabolic system they have and perhaps offer a medication regimen that might be best for their pain control.
So in the past, without this test, you'd give a patient a drug and it wouldn't work, or it would adversely affect them?
No. What would happen usually, when you see the doctor, a doctor will see you and provide you perhaps with a medication and then follow up with you 1 month later to see how you did.
Yeah.
But that takes that guessing out of the game. Essentially, I'm able to do this test on the first visit, prescribe them a medication once I receive the results, and really personalize their medication regimen, and oftentimes I get benefit.
And so is it working, or what are the results of this?
So for me, they've been wonderful. I've found that my patients have really appreciated the personalized discussion, designing a good regimen for them that helps them, particularly with chronic pain, which is a challenge for most of my patients. And certainly that test that we do for them, they take that information to other providers, primary care specialists. They can use it to maybe help them with other conditions such as heart disease, cancer.
Sure. Is there a type of patient or a type of person that is more likely to benefit from this?
Well, an individual who may be on multiple medications, sometimes called polypharmacy, would be a wonderful candidate for this type of test. Really looking at how they're metabolizing their drugs, if they're metabolizing them to get benefit or to perhaps get a drug interaction or adverse event, that would really help give that information to me.
Any disadvantages?
There's still a lot of information that needs to be learned about genetic testing in general. Pharmacogenetics has been around for years. This test I've been using for the last 6 months. So really the research that's been going on has been finally brought to the clinician's hand to use. So there's still a lot more evidence that's needed. The evidence is promising, but more needs to be done.
Have you had patients who you gave this test to, who then you prescribed a different medication and they were so grateful, like it actually made a difference in their lives?
Of course. And, not every patient will have the wonderful benefit, but certainly it does help me design a very personalized regimen based upon their genetic makeup.
And it's applied to a variety of health problems. You mentioned patients who take a lot of medication.
That's right. And oftentimes I have patients who are taking pain medications, who may be taking other medications, say for depression. And a lot of times when I go back and review the results with them, I find that there may be a drug interaction that was unidentified, and perhaps that may be why the medication regimen was not working the way it should have. So again, this test provides a lot of resources to, one, predict the outcome of the medication, and also to potentially divert any drug interaction or adverse event.
What about like a false positive, like you give the test to somebody and it doesn't work, or it gives you the wrong results, or it points you in the wrong direction? Does that happen?
Well, it certainly can, but often, with a physician who is comfortable reading the results, has used it often enough, the results can be very informative.
Okay, so where can people get more information?
There's a lot of information online, of course.
Yeah.
But first and foremost, patients need to have a discussion with their physician to see if they're an appropriate candidate. The doctors need to be informed on how to use the test appropriately, and certainly they can consult the National Library of Medicine. There's plenty of evidence.
Excellent. And all you need is some saliva.
That's it.
Thanks for joining us, Dr. Gupta. And if you have a health question, you can send an email to drmanny@foxnews.com. I'm Rick Leventhal. Thanks for watching.